Good afternoon, everyone. My name is Lisa Uris, physical therapist and regional director at Spear Physical and Occupational Therapy. I'd like to welcome everyone who's been here before and has attended one of our previous webinars, as well as welcome those of you who are joining us for the first time. We appreciate you taking time out of your busy day to be here with us today. For those of you who don't know who we are, Spear is a private outpatient practice that has been around for over 20 years. We're currently over 20 locations located all over the New York City area. We have successfully continued to offer in-person care through the COVID-19 pandemic, as well as have launched Spear Live for those who are looking to stay home and receive care using our telehealth platform from the comfort of their own houses. In our clinics, we are strategically going above and beyond the CDC guidelines to ensure the safety and well-being of everyone. You can find more detailed information on those safety measures by visiting our website at spearcenter.com. We are here for you in whichever way makes you feel most comfortable. If you're looking for individualized care, either in the clinic or through telehealth, please reach out to us at your convenience and we'll get you set up for an appointment right away. We're excited to be with you today to discuss postpartum care and how it relates to pelvic health. We'll be discussing different delivery methods, common symptoms following pregnancy, and how to safely return to exercise following birth. As part of our session today, we'll be taking time out to demonstrate and talk through some of these exercises that you can do, and we welcome you to follow along and practice with us as you feel comfortable. Please note that if you're experiencing any pain while performing any of these exercises or you feel unsafe in any way, please definitely stop and reach out to us directly so that we can support you. As you can see, we're coming to you live from our own homes, and although we don't anticipate any technical issues today, please be patient with us should any arise as we navigate through the technology. So throughout the webinar, we want to hear from you. If you have any questions, please feel free to let us know your thoughts in the Q&A feature. You can find this feature if you take a moment to hover at the bottom of your screen. You can see the Q&A option pop up down on the bottom. This is where we would ask that you put your questions and we'll do our best to address them during the webinar. It's best to put your questions in the Q&A because we'll be monitoring that more closely than the chat feature. For those of you who are watching through YouTube Live, we are monitoring the comment section there as well, so please feel free to type in any questions there also. Lastly, there will be times where multiple panelists are on the screen at the same time. So for best viewing experience, you'd want to be in gallery view so you can see us all together. To find gallery view, it's at the top right corner of your Zoom screen. And you can click that option and you can see multiple people on camera at the same time. All right, great. So let's talk about our goals for today and what we're going to be covering. So today we're going to explain the anatomy and how our bodies change during and after pregnancy. We're going to discuss different delivery methods and how that can impact your pelvic floor. We're going to explain and talk through how to safely return to exercise after pregnancy and demonstrate some low impact exercises, as well as talk through return to jumping and running and things like that. We'll also be talking through a C-section massage and a perineal massage that you can do at home also. Lastly, like I said, we want to hear from you. We're here to answer some of your questions live, so feel free to put your questions in the Q&A feature throughout the webinar. Okay, so before we get started officially, I'd like to introduce our team of panelists. We're going to welcome everybody onto the screen now. Our presenters today are Bianca Ambrosino and Jessie Weinberg. Bianca is a physical therapist and pelvic health specialist at our Upper West Side office on 75th Street. Hey, Bianca.
Hi, guys.
Good to have you here. And Jessie Weinberg is our pelvic health program director and a physical therapist and pelvic health specialist from our Broad Street location down in the financial district. Hey, Jessie.
Hey, everyone.
Lastly, we have Sarah Shoemaker, who is also a physical therapist and pelvic health specialist at our Chambers Street office in Tribeca. She's going to be helping us with answering your questions in the Q&A today. Hey, Sarah.
Hey.
Thank you all for joining. Just a reminder to everybody, it's best to be in gallery view so you can see us all at the same time. This is a good time to check that out. Again, the gallery view is on the top right corner of your screen. Okay, so let's get officially started. Jessie, Sarah, and I are going to say goodbye for now. And Bianca, we're going to let you take it away with a discussion on anatomy.
Great. Thanks so much for the intro, Lisa. So this webinar today is for moms, those who are expecting, those looking to conceive in the future, and individuals who are there supporting our new moms. I'm going to go over some anatomy and discuss how our bodies change during and after pregnancy. So during pregnancy, our bodies go through some changes in order to meet the needs of the growing fetus and prepare our bodies for childbirth. There's an increase in the size of the uterus along with abdominal extension, weight gain, breast enlargement, and postural changes, which can lead to a variety of musculoskeletal changes. The weight of the baby also puts pressure down on our pelvic floor. So I have a picture of our pelvic floor up there, and then also, how our posture changes with our growing belly. But what happens after childbirth? During the first year postpartum, many women are less informed about their own bodies, even as they learn vast amounts about their babies. While your baby will have frequent and thorough checkups with their pediatrician, most women only have a 6-week follow-up. Many are cleared for sex and exercise at 6 weeks postpartum, despite the fact that their bodies need much longer to heal. So I'm going to bring Jessie back on screen. Jessie, can you tell us a little bit about different delivery methods?
All right, I'm back. Yes, I can. But before we get into that, I wanted to do a quick poll for those of you who are attending the webinar. So give us a second, we'll pull up the poll. So the question is here, for those of you who have given birth and feel comfortable sharing with us, what was the delivery method? Did you have a vaginal birth? Did you have C-section? For people who've had multiple kids, do you have both? Just put your answer in there and we'll see what we got going on. All right, so majority of you have had vaginal delivery, some C-section, and some both. Great, so we have a pretty mixed bag here. So I'll start talking about different delivery methods. So both vaginal and cesarean delivery require some time for the body to heal. And both delivery methods have some unique challenges. So let's talk about the mechanisms behind each delivery method. Vaginal delivery involves the baby being delivered via the vaginal canal, putting a little bit of strain on both the pelvic floor muscles and the pelvis. During a C-section, the baby is removed surgically, which requires separation of the abdominal tissue and is considered a major abdominal surgery. Both vaginal deliveries and C-sections, as well as pregnancy, put the pelvic floor at risk for possible pelvic floor dysfunction. So both types of deliveries may lead to bladder and bowel dysfunction, prolapse, and diastasis recti. We'll be talking about all those things shortly. Vaginal deliveries tend to be a little more disruptive to the perineum, or the tissue between the vaginal opening and the anus, as that's where the tearing occurs, and also it gets stretched during childbirth. So this may cause some pain and sensitivity to the touch after tissue healing. C-sections often require a little bit longer healing time since it's a major abdominal surgery that is removing the baby. So, a couple different considerations here depending on the delivery mode. And although this sounds kind of scary, your body does heal from both delivery modes. And there's a lot you can do in postpartum recovery with a trained professional to assist you through this healing process. So I'm going to hand it off to Bianca. She'll talk us through vaginal births, tearing, and perineal massage.
Thanks, Jessie. So during vaginal birth, most women have some amount of tearing, whether this be spontaneous or through an episiotomy, which is where they make an incision into the perineal body in order to give a little bit more space in the vaginal canal. So most tearing will require sutures to the perineum and or the internal tissue. During the early stages of recovery, you might experience bleeding, swelling, and pain with urination or bowel movements. During this time, it might be helpful to use padsicles or a frozen pad or ice pad right on your vulva. A sitz bath or a warm shallow bath might also be helpful to aid in kind of healing and ease any discomfort. Immediately postpartum, you can choose to use a peri bottle or a squirt bottle instead of wiping with toilet paper. During bowel movements, it is important to avoid straining, so you may be prescribed a stool softener by your midwife or your OB. Drinking lots of water to improve stool consistency and using a squatty potty can also make passing bowel movements much easier. After your 6-week follow-up appointment, you may begin gentle scar massage. So I'm going to bring up our pelvic model. So our perineum is right here. Starting at about 6 weeks, you can gently massage the area using your index finger. When things get a little bit more comfortable, you can do slightly more at that area. So the most comfortable position is to be in a kind of semi-reclined position, and you can hook your thumb into the bottom of the vaginal opening and your index finger on the other side and just gently massage the tissue. If this is something you're uncomfortable getting started with on your own, this is something pelvic PT can help you with. And so this scar massage can help with pain at the site of the incision and can help if you're experiencing any pain with intercourse. I'm gonna go talk a little bit more about pain with intercourse later as well. I'm gonna pass it back over to Jessie, who's gonna talk a little bit more about C-section scar massage.
Thanks. So for those of you who've had a C-section, as I mentioned before, it's a major abdominal surgery where your OB cuts through several layers of tissue, including skin, fat, fascia. They separate the abdominal tissue and finally get to the uterus. So there are steps you can take to heal after the procedure. Usually your doctor will clear you for exercise around 6 to 8 weeks if there were no complications with the procedure or healing process. You can ask your doctor if you're able to start performing diaphragmatic breathing once you're feeling symptom-free after surgery. So diaphragmatic breathing is essentially belly breathing. You perform this by inhaling. Your belly is going to rise up or expand. Your pelvic floor is also going to expand or relax. And then when you exhale, you're just going to gently activate your abdominal muscles in towards your spine. So this helps with healing by coordinating your breathing, abdominal muscles, and pelvic floor muscles. Another important component is performing C-section scar mobilization. You can start doing this as soon as your doctor clears you to perform it. You should definitely not be doing this if the scar is open, bleeding, oozing, or not completely healed. So I'll demonstrate on myself. So I have a little line in my leggings here. So we'll pretend that this is my C-section scar, okay? So what you're gonna do is first, you're just gonna take a look at the scar here. A lot of people have an aversion to looking at it as well. So even just looking at the scar and connecting to it can be really helpful. But first, what you're gonna do is start with light touch. So you're gonna start above your scar, below your scar, and then on top of your scar. And you can do this in many different directions. So I was just going side to side, but you can go up and down or in circles, okay? So in different directions as well. You may notice that there's some numbness or a lot of sensitivity in one area versus another. You know, this is common, and that's why we're doing these techniques. After you do your light touch with your hands, you can also incorporate different textures, including a tissue, a washcloth, a loofah, and this helps desensitize the area to different textures as well. So after that, you're gonna do some myofascial stretching. Usually you'd be laying down for this, but I'm showing it standing up so you can see. So for the myofascial mobilization, what you're gonna do is you're gonna get the skin on top of the scar, and you're just gonna pull upward and downward, side to side, and you can also incorporate some of that rotation. And you can do this in multiple different spots, right? So I'm above the scar right now. You can do this below the scar as well, and on top of the scar, okay? This helps stretch and mobilize the tissue so that things can slide and glide in a healthy way. After that, you can do some deep pressure as long as you can tolerate it. So kind of getting into the tissue underneath where the scar is. And this kind of works on any scar tissue or restrictions that have formed underneath after healing. So in all different directions as well. So side to side, up and down, and circles. And there may be some areas where you feel it's more sensitive, and that's okay, you can work on those spots. If you are feeling that it's really sensitive and uncomfortable, you don't need to do all of those steps. So you can just stick with the light touch or the stretching. You kind of need to do what works for you. If it's excruciatingly painful, that's not helpful, right? So you can incorporate all of those techniques. So hopefully that was helpful for your C-section scar mobilization. So next we're going to shift gears a little bit. Bianca is going to talk about urinary leakage.
Thanks, Jessie. So during and after pregnancy, you might experience a little bit of urinary leakage. So stress urinary incontinence is when physical stress, like sneezing, coughing, laughing, jumping, running after your kids, may cause a little bit of urinary leakage. This is common after pregnancy and childbirth. However, this does not need to be your new normal. So Kegels are one way in which we can work on decreasing urinary leakage. So Kegels are pelvic floor muscle contraction. And in order to do a Kegel, you're going to want to coordinate your breathing with the contraction. So kind of going off of some of the information that Jessie had given us about diaphragmatic breathing, we're going to take a nice inhale, and then on our exhale, we're going to think about drawing up and lifting. So one of my favorite images is on that exhale, you're picking up a blueberry, and then on the inhale, you're dropping it back down. So that's something to kind of get you started. If you feel like maybe you're doing Kegels ineffectively, or you feel like they may be causing any pain or discomfort, causing more leakage, then it might be helpful to get someone to go over the coordination with you. And that is something you can get guidance from a pelvic floor physical therapist for. And also, in addition to strengthening the pelvic floor muscles, it's going to be important to work on core and glute strengthening, and then also make sure we're coordinating our breathing with our activities. So sometimes when we do an activity like picking up something heavy, we put extra pressure down on the pelvic floor, which can cause leakage. So thinking about exhaling with the effortful part of our movement can really help us in decreasing that pressure down on the pelvic floor, which can lead to a little bit of extra leakage. Jessie, can you tell us a little bit about prolapse, since it can also play a big role in urinary leakage?
Yes, definitely. So pelvic organ prolapse is when one of the organs in your pelvis, whether it be the bladder, uterus, or the rectum, descends down into the vaginal wall. So this is very common after pregnancy, and specifically after vaginal deliveries. So as pelvic health professionals, we grade prolapse from grade 1, or least severe, to grade 4. So a grade 1 is a minor descent of one of those organs into the vaginal canal. Grade 2 is a descent to the vaginal opening, but not past it. Grade 3 is a descent a little bit past the vaginal opening, and grade 4 is a little bit further past the vaginal opening. So what's interesting about prolapse is the grade of prolapse does not always correlate with your symptoms. It's possible to have a symptomatic low-grade prolapse or an asymptomatic higher-grade prolapse. So common complaints of prolapse are feeling like a heaviness or a drawing down in the pelvis, or feeling of bulging, or even noticing some tissue bulging out of the vaginal canal, as well as feeling like a tampon or something like that is stuck in the vaginal or rectal canal. So prolapse is, although it sounds very scary, very common, especially amongst women who've given birth or have been pregnant, and sometimes in older adults or even patients who've experienced chronic constipation with a lot of pushing and straining. So depending on the severity, this can be very treatable with pelvic PT alone and no surgery. In addition to PT, there are some non-surgical interventions that may include an external support garment with vulvar compression, so kind of like an underwear that you would wear outside, as well as a pessary, which is an internal support. Pessaries usually need to be fitted by your urogynecologist. If you feel like you have a prolapse, it probably would be best to make an appointment with a pelvic floor therapist. You can get it assessed, as well as learn the most appropriate interventions. So pelvic floor therapy can be helpful in treating prolapse by strengthening the pelvic floor, so like what Bianca mentioned with the Kegels and strengthening, as well as the hip and core musculature, we can't forget about those, as well as assisting you in activity modification so you can get back to doing whatever activities you love to do. So again, shifting gears a little bit, but we're going to go back to what Bianca mentioned about resuming sex postpartum. Can you tell us a little bit more about that?
Sure, Jessie. So you just had your 6-week follow-up appointment, and you've been cleared to have intercourse, and you don't feel ready. You're definitely not alone. There's no rush, and you should wait until you feel ready. Likely you're still healing. So if penetrative sex hurts after the first few times, go slow. Use lube, and try non-intercourse forms of sex. It's common to feel discomfort or pain the first few times you've penetrated sex after childbirth, but after that, don't put up with it. You may want to see a pelvic floor physical therapist. There's a few different reasons why you might be experiencing some pain. It might be due to tight or hyperactive pelvic floor muscles, scar tissue at the perineum, a change in natural lubrication due to hormones, or it could be, if you've had a C-section, sometimes it can be very uncomfortable at the site of your C-section scar. So I want to talk a little bit also, changing gears again, about hip and low back pain after having a baby. So it's very common to have some hip and low back pain. You think a lot of those issues are going to go away after childbirth, but some of them may linger. Carrying, lifting baby, and breastfeeding are all very hard physical work, especially for a woman who is just pregnant and is still recovering. So your posture and movement habits change during pregnancy from carrying around extra weight in new places, and your body also produces the hormones relaxin and progesterone, which loosen your ligaments and joints. So I'm going to go over some lifting mechanics, and Jessie's going to demonstrate some of them for us.
I have my my sample baby, so we'll be using this one as a prop.
So first, Jessie's going to hold the baby on one side. So super common when holding the baby out on one side to kind of jut our hip out. We also tend to carry the baby only on one side. So we really want to make sure we're standing up nice and tall, and that we're switching the baby, the side you're holding the baby on throughout the day. So going into baby wearing. So baby wearing is great because you get to be hands-free all day, you get to do other activities, but it can be really hard on your body. Baby wearing is definitely an endurance sport. So make sure that you are, again, standing up nice and tall, and that you are not completely tucking your hips underneath or creating more of an arch in your low back. And also just make sure you're changing positions throughout the day. Don't go 0 to 100 and start carrying the baby around for hours at a time. So now we're going to talk a little about picking the baby up from maybe the crib or a changing table. So you want to make sure you're standing really nice to the edge, really close to the edge of the crib, that you're not picking up the baby at a weird angle, that you're not picking up the baby out really far in front of you. So you're going to come nice and close to the crib. First, you're going to want to move from your hips. So pushing hips back with a nice flat back. Then bend at the knees. You're going to grab the baby and bring them right into your body. Awesome. Thanks so much for helping me out with that, Jessie.
Yeah, I think the thing behind me was blocking a little bit, so maybe this would be a little bit better. You can see.
Perfect, perfect. That really beautiful, nice pattern's going to really protect your back. So Jessie, can you tell us a little bit about diastasis recti? I know that's a big concern a lot of our postpartum.
Yes, a very popular topic. So diastasis or diastasis, there are a few different ways to pronounce it. I just say diastasis. Is very common during and after pregnancy. So diastasis is when the left and right sides of the abdomen separate. This happens during pregnancy in order to accommodate for the growth of the baby. This can persist postpartum as well. So this usually presents as a bulging or a divot in the middle of the abdomen with activities with increased effort like sitting up out of bed, doing a crunch, or a plank. So as pelvic health professionals, we measure diastasis by finger widths across the abdomen, as well as depth in which your fingers sink down into the abdomen, and then also the contractile strength of each side of the abdominal muscles. So the treatment is to work on deep abdominal strengthening. This includes a variety of core stabilization activities in all different positions, as well as learning abdominal activation during daily activities like squats, lifting, running, and jumping. Very similar to what Bianca talked about with the exhale with effort when standing up. And we just kind of go through those core strengthening activities while we're doing that. So the one interesting thing about diastasis, there's not a lot of research on predictive factors for what's going to help successfully close the gap. So our goal in therapy is to help you get stronger and perform your daily activities and recreational activities with good form and pain-free. Although we're certain that PT will get you stronger, it's unclear whether these same techniques will also improve the cosmetic appearance of the separation. This is highly variable from patient to patient. If you're experiencing diastasis, I usually like to say, come in, get a consult with a pelvic health therapist on appropriate interventions to address it, because each treatment plan is unique to your own needs. So Bianca's going to help me out. We're going to go through some low impact exercises that are safe to perform once you're cleared for exercise. So I think, Bianca, you got a treatment table right there to help us. So we're first going to start in quadruped. So that's on your hands and knees. If you're at home, you're welcome to follow along with us, as long as you don't have any pain or symptoms or issues in any of these positions. So we're first going to work on TA activation in quadruped. TA is the transverse abdominis. And I like to start this with diaphragmatic breathing as well. So when you inhale, you want to drop your belly down towards the table, relax your tummy, and relax your pelvic floor. And then when you exhale, you're going to pull the belly button in towards your spine, and you're going to bring the two sides of the hip bones or the two sides of the abdominal muscles together. That's a TA contraction, okay? We'll try this a couple more times. Bianca, breathe in, belly's going to expand. And then when you exhale, you're pulling your belly button in towards your spine, bringing those hip bones together. I also like to think about the hip bones as if they're magnets kind of being drawn towards each other. I just like that visual. We'll do one more. Inhale, drop your belly. Exhale, pull your belly button in towards your spine. Very good. Okay, from there, we're going to lay on your back. Figure we do all the table stuff first, or if you guys are on the floor. So this one, we're going to do a march. So you're going to engage your deep core similar to as we did in quadruped. You're going to draw your hip bones in towards each other. You're going to march 1 foot closer. Yeah, good. Up and then down. And then the other leg up. Good. And down. You can see Bianca is really using her abdominal muscles to control this motion. She's not just whipping the leg up, and because that would be very easy. You're using your abdominals to kind of scoop that leg up. You want to make sure that your pelvis is not rotating side to side, and that you're maintaining this abdominal contraction. We usually do 10 each side. We don't need to do 10 though. That was just the example. The next one we're going to do is a little bit harder. This one's a modified side plank. So Bianca is going to lay on her side, knees bent, and she's going to be propped up on her forearm. Again, we're going to engage the abdominal muscles, belly button in towards spine, hips drawing in towards each other. She's going to lift her hips up and forward and hold. This one's a little bit more challenging. So if you feel like you're not strong enough to do this one, or if you feel it's uncomfortable, definitely skip. But if you feel like you're ready for the next step, this is a good one to work on the lateral core, the outside. Very good. One last one that we're going to do is practicing a sit to stand. So Bianca's going to be sitting in the chair. And then from here, before she gets up, again, we're going to do that exhale with effort. Engaging the TA, belly button towards spine, and stand up. Very good. Awesome. So those are the ones we have for you. Pretty basic, but also pretty fundamental. So I like starting with these, and we can always progress to harder activities from there. All right, so Bianca is going to talk us through some jumping jack progressions, and I will help demonstrate.
Yeah, so jumping is definitely a much higher level activity and one that puts a lot of stress down on the pelvic floor. So a common complaint I get is, I feel strong enough to go back to my fitness classes, but activities like jumping jacks might just be a little bit too much for me. I'm really concerned about leaking urine while I'm in a class. Obviously not as big an issue right now, but for the future. So there's no reason to feel limited from your favorite Zumba or boot camp class forever. So when returning to jumping, it's important to do it in a gradual way to kind of acclimate your pelvic floor muscles to this extra stress. So Jessie's gonna go over some return to jumping jacks with me. So let's start with our legs narrow, and Jessie's just gonna do a little bounce for us. So if we can do this, no symptoms, and symptoms would mean heaviness in the pelvic floor, any leakage, any increase in prolapse symptoms, we can move on. So now we're gonna widen out the legs a little bit, and we're gonna do a wider stance bounce. Very nice, Jessie. And then we're gonna move back to the narrow stance, and we're gonna start with a hop. So a little more pep in her step. The next progression for this would be to come out into a wider leg hop. Once this is feeling super comfortable, we're gonna do jumping jacks, but just with the legs. So actually adding back in the arms is going to be more pressure. So when she feels good with the legs, Jessie, I'm gonna have you do a full jumping jack with arms bent. Great job. And when this is feeling good, it's time to move back into our full jumping jacks with our arms straight. And thank you so much, Jessie. It's also really important to remember during jumping exercises that we're not holding our breath. We're keeping nice, even breathing. Sometimes when we get fatigued, we start holding our breath, and that puts extra pressure down on the pelvic floor. So Jessie, do you want to talk a little bit about return to running?
Yes, thank you. I think I broke a sweat doing that. So thanks for the little, mid-evening workout. Okay, so running. This is usually a big concern for patients who ran either during pregnancy, before pregnancy, and want to get back to running. So running is another high impact activity that puts a lot of stress on the pelvic floor. Before returning to running, it's important to make sure your pelvic floor, core, and hip musculature are strong enough for the high demand. Here's a quick assessment you can do to see if you're ready to return to running. Again, if you feel any pain, heaviness in the pelvis, incontinence during this assessment, you're likely not ready to return to running. This also might be a great time to visit a pelvic floor therapist and can help you with an exercise program to get back to running. So Bianca's gonna help me out. The first thing is walking 30 minutes with no symptoms. Obviously, we're not gonna test that one all, the whole thing out. So just regular walking, 30 minutes. You guys can do that on your own. The next is single leg balance for 10 seconds. So you should be able to do this on both sides. Single leg balance, no problem, for 10 seconds. So again, shouldn't feel any pressure in your pelvis, shouldn't feel any incontinence, shouldn't feel any symptoms here. The next is a single leg squat, 10 reps per side. So you're gonna be standing on one leg, good, and you're gonna squat down and back up. This doesn't need to be like, tush to the ground squat, just like a nice squat like Bianca's demonstrating here. Again, you should be able to do this both sides. Great. Next is jogging in place for 1 minute. Okay, so we're working on that single leg stance and also adding a little bit of plyometric activity in here. So the bouncing and running a little bit. The next is forward bounds for 10 repetitions. So again, we'll be working on kind of the jumping here, also going forward. So very similar to what running is. And that we'll do that for 10 repetitions. The next is hopping in place for 10 reps. Good. So working on that single leg balance, plyometric activity on one side. We'll do 10 repetitions each side. And then the last one is single leg running man. So we'll do this by lunging back. So we'll lunge back with one leg. Good. And then back up to single leg stance. So we're mimicking kind of an exaggerated motion of running. And yes, as you can see, Bianca's using her opposite arms here to kind of get that motion as well. So you get a little bit of thoracic rotation, a little bit of pelvic rotation, and again, working on that single leg stance. We like to do that 10 reps each side. So if you can finish all of those activities pain-free, you feel great, no symptoms, try running out. If you feel like you're having some symptoms, maybe one of those steps may be a good time to visit a pelvic floor therapist. So I think that's all we have in prepared material. I know we're gonna have a lot of questions. So now we'll bring Lisa back on the screen and she is going to help us moderate some of the questions.
Thank you guys so much. That was so helpful. I'm like, even just watching you guys go through different progressions of exercises, I feel like it's so important. All this information is so important for new moms, especially from people like you who have so much experience with this. So let's get to some questions. So one of the first questions that came in was, if I don't have any symptoms at all, should I still see a pelvic health specialist postpartum? What would you recommend?
I mean, I would say I'm biased, but I would also say yes, because there's no hurt in going to see a pelvic therapist. Usually you'll be cleared by your OB, but your OB is mostly looking at your organs, right? Your uterus and the scar tissue as well, where the pelvic therapist is looking at the function of your muscles and really focused on getting you back to doing physical activity. So if that's something that's important to you and you feel, even though you're symptom free, you can still get some good guidance. What do you think, Bianca? Anything to add?
I totally agree. And I think especially if you want to return to something like running, it can be really important to just get to a good fitness program so you make sure that you're not going to get injured.
Cool. And I guess something related to this about like when to see a therapist, when not to, if you have incontinence during pregnancy, would you recommend seeing a pelvic floor therapist, or is that expected to experience and that should just be, nope, it's just gonna be par for the course? What do you guys think?
I would definitely recommend seeing a pelvic floor physical therapist if you're experiencing any urinary leakage. So it's really important. During pregnancy, urinary leakage can be a symptom of there just being too much weight on the pelvic floor, but it also could be that our pelvic floor muscles are not able to fully contract and relax. So a pelvic floor physical therapist is really going to be able to help you make sure that those muscles are moving really well. And then we also will go through a lot of that, some of the breathing we talked about today, modifying activities to make sure we're not putting any extra undue pressure down on the pelvic floor.
Awesome. And I guess speak to quickly, I mean, obviously with things going on today, can you speak to treating pelvic floor conditions through telehealth? And are you guys doing that? And how do you do that?
That's a great question. So I think the biggest confusion, I guess you could say, for patients, like, well, how do you know what's going on if you can't do the physical assessment? And, you know, I've told my patients most of the time, really with any condition, symptoms follow a very predictable pattern, right? So just by telling us what's going on, we can usually tell without doing a physical assessment what's going on with you. Not all the time, right? But sometimes. And so we'll usually know if we need to work on some of that up training or strengthening, or if it's something else that we would really, need you to come into the clinic for. But either way, we work with patients where they're at. If they're uncomfortable coming into the clinic, we'll implement a plan of care through telehealth. We're able to progress your exercises and cue you verbally as opposed to touching, right? We know how to do that too. And actually, it's been really effective, especially for my patients who have babies, because, they have to be home with them. So I found it to be great.
Awesome. That's great. Thank you, guys. Okay, so a couple questions came in about massage. So one, in terms of the perineal massage, how frequently and for how long do you recommend people do that for? And when should someone start that if they're pregnant?
So for perineal massage during pregnancy, most people start at about 34 weeks. I would say that's when we kind of think it to be the most beneficial. And for perineal massage during pregnancy, I suggest one time a day to one time every other day for 5 to 10 minutes. I would use, get yourself in a really nice, comfortable position. You might ask someone else for assistance because sometimes it can be a little bit difficult to get around your belly, and you can use kind of a nice oil or a lubricant to kind of just gently massage the tissue. You really should not be in pain while you're doing this. Same thing goes with postpartum. The tissue might be a little bit more sensitive postpartum, so you might want to start really nice and slow. Just like Jessie said about the C-section scar massage, it's really okay the first few times to be really, really nice and light. Get the tissue kind of acclimated to touch, and then you can move up to a few minutes every day.
Awesome. And then I guess in terms of, on the flip side of that, in terms of C-section massage, aside from aesthetics, what are some of the benefits to doing a C-section scar massage? And also then how frequently and for how long do you recommend people do them for?
Yeah, that's a great question. So a lot of time patients will have numbness or like increased pain around the area of the scar. And although at first the massage might feel a little uncomfortable, over time that's going to help that tissue become less sensitive and painful and just feel like the rest of your abdomen. When it comes to that myofascial release, doing that slide and glide just helps your body move. So the fascia is the tissue that sits underneath the skin and above the muscles. And we need that healthy slide and glide in order to achieve pain-free vaginal penetration, in order to move through your lumbopelvic spine, in order to reach overhead, believe it or not, with your shoulder. So doing the scar massage actually just helps with sensation, mobility, and then that deeper massage is kind of to rid any like internal scar tissue.
Just adding to what Jessie's saying as well, I find that my patients who have any discomfort around their C-section scar massage tend to be chest breathers. We're not getting nice deep inhalations deep into the belly, and sometimes we're not getting as good core activation during activities because we're kind of trying to guard and avoid that area. So it can be really helpful as we kind of increase our activity levels.
Great point.
Great job, guys. Okay, so what do you guys think? Like if somebody didn't do these practices right after birth, like all the things that you're recommending in terms of the massages and the exercises, can they still do it? Is it too late to start?
I would say it's never too late to start. And this is actually a very common question. I think I've had patients come to me years later. I've had patients come to me 4 months postpartum say, oh my God, it's too late. It's not too late. It's okay. We can still implement a lot of these, treatment techniques, even if it's scar massage and it was, 10 years ago that you had a C-section. So, or even vaginal birth and you have sensitivity on the perineum. So no, it's definitely not